So this week marks Eczema Week. It's a time dedicated to raising awareness of the skill ailment, and that mostly affects children, but also sometimes adults. The most common symptom is inflamed, dry and itchy skin that can affect the entire body. Many sufferers struggle to control it, and it has a significant psychological impact. The good news, though, is that the condition is largely manageable. For more on this, let's bring in Dr. Dave Kaplan, who joins us now live via Zoom in Johannesburg to help us understand this better. Doc, thanks very much for always making time for the AM report. Welcome back. I'm interested to find out how you would even begin explaining what eczema is. I mean, we all know what itchy skin looks, feels like, but how do we distinguish that from a normal itch to something like eczema?
Well, the first thing, good morning to the listeners. The first thing, it's always difficult. When you get any rash, it's very difficult. And even people who've studied rashes and skin conditions for years, called dermatologists, sometimes also struggle. But usually eczema is a dry, as you said, itchy, red, raised condition of the skin. And usually the mom comes to you and she's concerned because it seems to be dry or flaking, or the child seems to be scratching a lot. Often it interrupts sleep, and you can see scratch marks on the skin. The most important thing is the connection between conditions called atopy. Now, atopy is what we know as hay fever, itchy eyes. Sometimes you've got a bit of asthma, etc. So it's that kind of allergic condition that sometimes sets off the skin rash. And often the skin rash is related to things you may have eaten or things you may have inhaled, like grass pollens, ordinary tree pollens, pollens from flowers that are flowering now in spring. And that's why it's Eczema Week now, because all the trees are flowering, all the plants are flowering, and the children are going wild with their itchy skins.
Right. It links quite well to a question I was hoping to ask during our conversation, but since you've already touched on it, let's go there. Is this something that's genetic, hereditary, or, as I guess you've alluded, a function of our environment?
Well, it's both, because often families who have asthma and food allergy often will have children who have eczema, and so there is a genetic thing, but not all the time. But people who have parents who have asthma and who may have had eczema in the past are more predisposed to getting this condition.
And Doc, what is it about a child's skin that makes children prone to this ailment? I mean, some adults do get it, we do concede that, but my understanding is that the trend is that it's most prevalent amongst young people.
Yeah, the child, in the early years, the child's skin is very, very, very sensitive. And just as quick as they can develop eczema, it can disappear as well if you use common moisturizing creams and stuff. But sometimes you might have to go and see a doctor, and he may need to use creams that contain cortisone and other medications so that you can get control of this very irritating skin condition.
My understanding is also that eczema is actually the umbrella term that houses, I guess, different types of ailments. Speak to us about atopic eczema and, I guess how that works in one's body.
Okay, so atopic eczema is the eczema that I'm talking about when it is related to asthma and food allergies. So it's an allergic kind of eczema. The other eczemas you can get are contact eczema, contact dermatitis eczema, and that is often seen with people who've been sanitizing their hands with soaps and different kinds of hand sanitizers, and then suddenly they get this rash on their hands, and their hands are very, that's a contact dermatitis to the sanitizer. And there are some people who are really struggling with hand sanitizers because they get eczema of their hands. And then there are other conditions where you can get eczema, for example, to a watch. Also a kind of a contact eczema, but different because the body reacts to metals, etc.
You've touched on sanitizers, which opens the conversation around hygiene when you've got eczema. The perception, at least for those of us who aren't medical experts like you, is the more hygienic you are, the less prone you are to developing something like eczema. How factual is that really?
I think that's a little bit harsh. I think most people try to be as clean as their conditions allow.
Yeah.
And where the hygiene comes into it is the skin is a natural barrier to bacteria and other pathogens that might invade the skin, like fungi. And when people are scratching their skin because it's so itchy, they scratch away the top epidermis layer of the skin, they breach the skin, and now the skin, instead of protecting us from outside, it's easy to get infections from all the bacteria that are around us all the time. So I think that is a little bit harsh. I think most people are hygienic, and but when you have been scratching too much, it's very easy for these skin conditions to become a little bit infected, usually with a crusty, goldy, flaky kind of infection, and that's commonly caused by a Staphylococcus organism. It's got a funny name.
Yeah, and what does that mean, Doc? I mean, help us understand that term a bit better.
Oh no, then you would just have to, pay attention. One of the ways that one could do is one could take if you were really concerned, sometimes in America, the Dermatological Association of America have suggested taking half a cup of normal house bleach, not concentrated bleach, and putting it in a full bath of water, just to make the water a little bit more antibacterial, and then have what's called a bleach bath. But that's very tricky, and you must be careful on the concentrations of the bleach. It's just normal house bleach, and you use very little bit of it. I would start off with maybe a half a cup into a glass of, not a glass, half a cup into a bath of water.
Sure, all right. Very quickly, Doc, I'm being told I'm out of time, and I'm probably going to be in trouble for this, but if you have pets, are you able to continue, I beg your pardon, if you have eczema, are you able to continue having pets? I mean, is there any impact that the ailment has with animals?
Well, as I said in the beginning, the allergy, the atopy dermatitis that you were talking about, animals can cause atopy. So if it's like cats and dogs and they are creating an atopic situation, then that's causing eczema, then you can't have your animals. But, a lot of people love their animals, and animals like dogs and cats represent an important part of a family life. So as long as it's not too bad, I think one can work around it.
Dr. Dave Kaplan, thanks very much for always coming through and helping us understand these issues better. Dr. Dave Kaplan there is a medical doctor speaking to us about Eczema Week. Perhaps you might be affected too. Hopefully you're a bit more empowered now that you understand how this ailment works.